Dr. West, what do you think about scars and how do you take care of them? So this is a question that comes up all the time because scars are so important as interference fields. So let's talk about what an interference field is. We have these energy pathways that either go on top of the skin or in the skin or under the skin that basically are these meridian pathways. Now in Oriental medicine and acupuncture is what happens is we want to get everything balanced, and diseases come from either too much energy in a meridian or too little energy in a meridian. And so it can be, the meridian system can be interrupted with trauma, or the organ system can be basically throwing off so much energy that it affects the meridian channel. So when I first started practice, I thought everything was biochemistry, everything was biomechanics, biochemistry, hormone function, and this energy thing that my dad was into was kind of a little wookie. Well, what happened is 22 years later, I'm recognizing it is such an important part of health. Your energy is not only what you create and transmit, but also what you absorb. And it's something that's really, really neglected in the traditional Western medicine paradigm. And what is one of the things that really throws off your energy or your meridian system is scars. Now, sometimes scars are inevitable from, getting a cut, a scrape, an injury, a compound fracture. Like, it's not meant, we didn't intentionally create a scar, but what happens is there's a different charge inside of the skin on the scar. And as that energy on those meridians comes up and it hits it, it blocks it, like it can't pass it. And so what it does is it causes this pooling of energy or this interference field. And so looking at what we can do for scar therapy is when you reset those scars, like amazing things are like just phenomenal. And so looking at how we do this, when the skin, here it is, when a skin is cut as a result of injury or surgery, the densely packed sympathetic nerve fibers may heal poorly, and it disrupts the overall function of the autonomic nervous system. Signals may be transmitted improperly, or nerves may join in an aberrant fashion, and it's chaotic and it's noisy nerve activity inside of a scar. And I've had some really good outcomes with headaches, with chronic regional pain syndrome, which is Krebs disease. I've seen really good outcomes in organ system improvement, because if you treat the scar in the area over an organ, as the nerves come out of the brain, the central nervous system, the peripheral nervous system, that nerve goes through the organs, the muscles, and tissues to the skin, and then comes back. So if you have an interference field on top of that organ system, and we reset that interference field, what it does is it really helps to reset the organ system underneath. Dr. William Hushang, he said that this is a scar are an island of turbulence inside of the system. And so really a lot of diseases come the block of energy or interference fields. And so we have, when you start to treat those, and there's a way, my favorite way is to inject them with a glycolize ester of paraaminobenzoic acid, a specific type of B vitamin that causes the nerves to open, which is hyperpolarization, or close, which is depolarization, or reset. So this is one of the things that's so important, especially to do with chronic nerve problems. And it's called Sekunde phenomenon, which is a German word. It also means Hünecke phenomenon. And it was literally discovered by some brothers, Hünecke brothers, in 1925, that's found that scar tissue causes adhesions. It attaches to deeper sliding structures such as tendon, muscles, and viscera. And Dr. Claude Guiberteau showed that scars and adhesions observed during surgery. This is the first guy that said, hey, this isn't normal tissue. And many things that he showed was that adhesions from the skin attaching and restricting the sliding motion of a tendon. So the tendons are supposed to slide on each other like that. When you have surgery, what happens is that gets disrupted. And he was specifically talking about C-section scars. So scars constitute a natural repair by the body with dense fibrous connective tissue, and the wound heal with collagen is inferior quality than normal tissue. So in addition to restricting the motion, it interferes with normal physiologic exchange between the connected sides. So you have, this side, and then you have the Grand Canyon scar in the middle, and the nerves, blood vessels, lymphatics cease to connect or communicate through that tissue. So it just causes a lot of aberrant nerve transmission, electrical meridian transmission. And so what we want to do is let's clean that up. So he also stated that the temperature of the scars is a lot different. Sometimes you'll feel a scar and it'll be a lot hotter, and as much as 10 times hotter. And it may have, direct pain generators for the subcutaneous nerves and neuromas and inflammatory mediators. And the transmission from one area of the body to another is what we call fascial drag. There were some other doctors, a very famous osteopath named Dr. Upledger, that gave an example of a patient with chronic migraines produced by an appendectomy scar. So think about this. So you have migraines traditionally up here, and appendicitis is in the right lower quadrant. There's a scar there. It's literally blocking interference fields. And so what happened is he freed up or liberated the scar, and the migraine's gone away. And I've seen this happen in my own practice many times. When you start working on a scar, a lot of chronic health problems improve. And so this idea of improving scar function is just critical for health. I really like following the book. It's called The Manual of Neural Therapy in the scar treatment. So let's kind of go through your different options. So you can do acupuncture around the scar. I've seen that. It's pretty good outcomes. The needles are a little bit smaller, seems to have less impact than an injection. Also, using myofascial relief techniques and massaging the scar. And one of the things I encourage people to do is I really like cold pressed castor oil that you can just rub on the scar and start liberating some of those adhesions. That's a non-invasive, non-painful way to liberate it. Also, a consideration is DMSO or dimethyl sulfur oxide. To do that, I also really like just taking wheat germ and popping that, rubbing it over the skin. It seems to be really well tolerated, even if people are gluten sensitive. But that wheat germ oil has some hormone precursors in it that just helps to get the scars to be healthier. And then even using some oral glutathione or taking glutathione pills, popping those, putting them over the scar, or glutathione gel and rubbing those. Another consideration is using a red laser pointer, about 540 nanometers, and giving a couple seconds exposure over the skin periodically of the scar. I've just seen some really, really good outcomes. And I just had a tremendous success story happen in the office. So I wanted to share that with everyone and just really say, this is an important overlooked part of health. So if it's a mole scar or a surgery scar or a, some type of compound fracture scar or cosmetic scars from a augmentation or reconstructive surgery, I think it's really, really important to treat those.